My name's Professor John McNeill. I'm the head of the School of Public Health and Preventive Medicine at Monash University, and I've been the principal investigator of the ASPREE study with overall responsibility for its conduct in Australia. ASPREE was established to answer the question whether otherwise healthy people over the age of 70 should take aspirin every day to prolong good health. It took a lot of time to get a research proposal together and get this research proposal funded. And really it wasn't until 2010 that we had the resources in which to develop the study and get it underway. The study involved over 19,000 people over the age of 70. 16,700 of them were from Southeast Australia and about 2,500 were from the United States.
I'm Associate Professor Robin Woods. I'm one of the Chief Investigators of ASPREE and I'm also the Executive Officer and Director of the ASPREE program in Australia. People were recruited from and lived in the community, and this is distinct from hospital-based clinical trials. Potentially eligible patients of GPs were sent letters of invitation with a toll-free 1-800 number to call in if they were interested. This type of trial, the randomised controlled trial, is the gold standard of clinical trials. The aim is to have a cohort of people who have similar features, and then they're randomised equally to the study drug treatment. So half of our participants were on placebo and half were taking aspirin. Our study staff saw ASPREE participants every year in person for what we call a study visit, and this included the measurement of a range of clinical features such as blood pressure, also some questions about thinking and memory, and some physical function tests including hand grip strength test, and we did a 3-metre walk test as well. And every year we collected information about important health events that may have occurred in the previous 12 months. All of this relied on the professional skills of our ASPREE study staff. And I'm very proud of the team that we have who managed to maintain the requirements of this study throughout the 8 years of the trial.
My name's Angie Petropoulos. I, for ASPREE, worked originally with their biobank for a few years and then moved into their field staff, so I do visits for our participants annually.
My name's Jennifer Taylor. My role with the ASPREE study was as part of the admin team. We would field incoming calls and organise rooms with GP clinics and book participants in when they were due for their visits. A lot of these people, they downplay their role in this study. They say, I'm not doing anything very much. And they are just such generous people with their time, happy to be helping some research that won't benefit them, but they know future generations will benefit from it.
For me, the most rewarding part of the study, and I'm sure Jenny might probably agree, is being able to meet with participants and building really great relationships. And I'm very blessed to be able to have spent some time with some really incredible people. Our participants are just fantastic.
We discovered that aspirin was not effective in otherwise healthy people in prolonging the time that they spent in good health.
It's surprising, given that aspirin's been around for more than 100 years, that we don't know more about how it works and in particular the role of aspirin for older people and disease prevention. ASPREE will not only answer questions about aspirin as we age, but it's going to also provide the opportunity to look at factors that contribute to healthy ageing. I would like to say to our ASPREE participants a very big thank you. Whatever we find will matter. It will change clinical practice around the world. We will have a wealth of information about factors that contribute to good health and disease as we get older. One of the important things I was not expecting to get out of ASPREE was the meeting and working with older people who have become an inspiration to me. So many of them are busy and active and lead really sometimes quite exciting lives. It's reduced the fear of growing older.
I'd like to acknowledge the over 19,000 participants from Australia and the United States who participated in this study. All of them took their medications, participated in our many tests, and it was really them who we really have to thank enormously. This study's raised a lot of questions which will lead on to further study. There's an enormous amount of data that's been collected which will help us identify new opportunities to keep elderly people alive and healthier for longer.